IMvigor211 is a randomized phase 3 study in bladder cancer patients who have failed cisplatin-based therapy. It's a 931 patient study. The primary endpoint is overall survival. But the primary endpoint is overall survival in the biomarker positive population. So using the SP142 biomarker, you can select PD-L1 positive patients, and those PD-L1 positive patients were included in the study, and they were either given atezolizumab or chemotherapy. The results were unexpected in that they showed that it didn't just pick the winners for the atezolizumab, the biomarker also picked the winners for the chemotherapy. So the overall result of the trial was negative. When one looked at the ITT population, not just the biomarker positive population, but the whole population, you could see atezolizumab was associated with long-term durable remissions, and the Kaplan-Meier curve showed that atezolizumab was outperforming chemotherapy. That's in line with what we saw in the phase 1 and the phase 2, and that's one of the reasons why the EMA and the FDA continue to recommend this drug. So once we'd got the clinical results of the trial, we then wanted to further explore why the biomarker didn't work, and we did that using mutational analysis and gene expression analysis. The gene expression analysis, we looked specifically at a T effector type signature, and that's an established what we call TGE3, 3 specific genes. And we showed those genes were associated with PD-L1 expression. And we showed also that gene expression was also picking the winners for the chemotherapy as well as the immune therapy. The second part of the analysis looked at tumor mutational burden. And that tumor mutational burden, we know bladder cancer has a high tumor mutational burden, but we also know that that tumor mutational burden correlates with response. And in this trial, we tried to see if that was associated with a predictive or a prognostic biomarker. As I said before, PD-L1 was associated with a good prognosis, so was TGE. But tumor mutational burden was different. It was prognostic and not predictive. And actually that looks like, as it stands, it's exploratory, but it looks like a better biomarker. And this could easily become a new second generation biomarker. And then when you try and combine PD-L1 and TGE together, using 2 different biomarkers in the same set, you actually can find a subgroup of patients who do extremely well. So this, in my opinion, is a step forward in biomarker discovery in this environment. And it's allowed us to take 211, have a negative biomarker, explore the ITT population, and get promising results with a new biomarker, which I think is a step in the right direction.